They said I'm nothing, yeah. They said I've got.
Okay. Hello, my people. Una good evening, una welcome. For those of una wey don dey with us since December of last year, una know say today na im be the 19th episode for this our program Ability Inside Disability. My name na Mrs. Modupe Afizogun, and na me be CEO founder of Beautiful Hands Foundation. This Beautiful Hands Foundation, I get this Ability Inside Disability program. And why we start this program? We start this program because we want bring awareness to condition of people wey get learning and intellectual disabilities. Me wey dey talk to na so, me na mama of pikin wey get autism. I be special educator, special needs advocate, and I still get training for behavior therapy. And our goal for here, because you go see my other partners and guests wey dem don dey follow us things, and we hope to still bring more for una. Our program not be only for professionals, because we no want talk only from book. We want also talk from experience. So now go they meet papa, they meet mama, they meet brothers and sisters. Everybody go come talk their experience, so that all of us go fit take and learn, and people wey dey position of power go fit understand the impact of these conditions wey we dey talk about for this program, and why important for investment to enter both from government side and from private people side, so that we go fit make life better for plenty people and their families. So as I talked before, una welcome. Una wey dey with us before, una do well, so una join. Una wey new, una no go dey disappointed. So I go give ground for the guests and partners when I get for here, make them introduce themselves before we go start the program proper.
Okay, I go start from my side. My people, how una dey? I just want continue the thank una, just as Mrs. Afizogun don talk finish. I no go fit stop to the thank una, but I go continue to say thank you for joining us. Like she say, if you dey new, you no go dey disappointed. This program dey loaded. My name na Boniface Chukwuka Ofoka. I be the resident speech and language therapist for Open Doors for Special Learners, and they offer speech and language therapy to children and to adults who get problem when it comes to communication, when it comes to the talk. So we dey for this program, we want discuss a lot of things. So I go advise make you stay tuned. If you get friends, mama them, papa them waiting for house, invite them, send the links to them. May they kuku join us for this talk we did. Thank you.
My people, for people who don't they follow this program for some time now, it be like my voice no go really dey new. So my name na Ini Sam. I be special educator. I call follow be autism specialist, and they give me joy where every opportunity when I get to do on top this program to fit follow share my expertise, to increase awareness of these different conditions where they worry our children and people for our society. The whole idea now to increase understanding. You know, anything where you understand, you go know how to take follow
Well.
So our purpose now to increase understanding of these conditions and how we fit take the support these children and their families. The mainstay na say make we fit create society where they accommodating, where they inclusive, so that last everybody go there all right. So thank you, sir, na join us.
Okay, my people, now the program will start proper now, because na me be host, na me be presenter. And sometimes too, I go answer question when I ask myself. So make una ready for all. So the first person will go answer question now Oga Sam. This month where we dey so now April month. I will not say April month now autism month. The month don't almost finish now. That one don't mean say autism don't go. You know go. First of all, autism, you know get medicine. Now management, now life condition. But April na month wey be say at least for that 1 month, all of us go make am our job to take know wetin dey happen to this my pikin, wetin dey happen to this my neighbor pikin, wetin dey happen to this my student, wetin dey happen to this person, wetin dey happen to that person, because the way wey they dey do their things is different from how every other person dey do their own. Although na April wetin be the see me April 2nd na be the exact day, but I go still use the opportunity to ask Oga Ini make he explain to us this autism wetin e be.
Make you no be say we dey forget people wey never join us from beginning.
Exactly.
Because
that one join.
for quite some time now we don dey yarn about this
It's
autism.
19 now.
Exactly.
So we don't talk.
Episode
Ah,
19. So
we don't talk.
we go need still go back the beginning.
Yes,
and
small, yeah.
you get one thing, since when I begin this work to dey work with children with autism, they hardly pass wey I no dey try educate one person or another about the condition. So na something wey I dey do with joy. So now autism na another kind of special need condition wey dey as a result of say the brains of these people wey get this condition e dey wired differently.
Yes.
And the way the condition dey take affect person be say e dey affect people, individuals, children for 3 major areas. Their communication. First things first, people wey get this condition wey dem call autism, then they either some of them dey fit sabi talk, dem fit use their words to talk wetin they need. For some other ones, their ability to take talk, to use their words, they dey limited, and they get very few words. And those words myself, they go dey use am only when they feel like. So if you see person wey fit dey one whole day, you only say one thing. Or 2 things. If you say water
finish.
or sleep,
Or sleep.
He finish for there.
The whole day.
Then we can't get another category still under this communication wey dey completely non-verbal. Wey mean say dem no sabi talk yet. They no fit use their words to take talk. So that na one area where autism dey affect communication. Another area where autism dey follow affect na social interaction. So if you see pikin, no, you know say usually children dey like play with their friends. If pikin see where group of children gather, they wan go there, go follow put hand, play with the sand, cook with empty comb and everything. Exactly. But pikin when you get autism, because of the fact say the autism dey follow affect social interaction. When others dey play for group, they do things together, im go like dey alone. They do im own thing. If people dey run go this side, if you want dey go the opposite direction, or if you even follow the people go where they go, follow the children go where they go, but you no go join them inside their play. If dem fit dey play for here, im go dey face im own another direction. You wan do im own thing. So they follow find am difficult to build and to maintain relationships with other people. Another area when this condition dey affect, remember I talk say na 3 major areas: communication, social interaction. Another area na behavior. Na one very
that one na be the monster.
na one very strong area when autism dey affect behavior, and we dey group am under wetin they call repetitive behaviors, then restricted interest. Under the repetitive behaviors, from the word repetition, and as something wey go dey do, you go dey repeat am. So children or individuals when get this autism, you fit see pikin wey e go just dey, e go dey hum. E go dey hum. Reason no dey, e go just dey do. E go fit just dey hum like that non-stop. You fit see another child wey e go one day flap him hand. If he dey do hand like this or dey play with him fingers, dey look am or
You go dey do this one.
some kind mannerisms like this, where they come on with other children. Then you figure another pikin wey be say, if he enter this space now, he come sit down for this chair while they sit down. Now so you go dey push the chair, they go front and back. He go hard am to stop that activity. He just want to go back and forth.
Until he satisfied.
So now something wey they do repeatedly over and over, and plenty behaviors dey wey these children they do repeatedly. Plenty behaviors. Then restricted interests. Now come be say, for instance, maybe you talk about toys, things where children they play with. Pikin if you get a whole set of cars, maybe you get like 5-10 different toy cars, but you go only they play with one. Every time now that one you won't play with. If person carry down one car, wahala go dey. Problem. He won't play with that particular thing. If it be car, if it be particular toy, maybe teddy bear, or sometimes if it no even be something where you go feel say pikin suppose they use play.
Exactly.
if you go find one small stick where bend one kind.
Yes.
Now waiting you want like with that.
Yes.
Even if he wants sleep, he go keep that thing next to his head. Yes. If he wake up, he not see that stick. Problem. Problem. You understand? So restricted interest. They like something say he can't turn problem. Thank you. One particular food. They no go switch interest up another thing. So this now some of the presentations and we can't follow say autism as a condition. That's something they consider as lifelong condition. What in that one mean? Be say it not get cure. But with support, with intervention, with therapy, the overall quality of life of these children, of these individuals, we improve significantly. For some, if you don't even notice it, then they're different.
Especially early intervention.
Thank you very much.
Start quick.
So in a nutshell, now what autism be with that? Lifelong condition where result from different wiring of the brain. Where they affect communication, social interaction, and behavior.
Now all of us answer this question.
That's it. Teamwork.
So my people, I also now don't understand waiting autism mean now. So for this autism, as Oga Ini talk just now, the areas where we don't talk just now say intervention. So this intervention now plenty day. Medicine day, therapist day. As Oga Ini, when he introduced himself just now, he say then academics day. Academics day. He say in a special educator and in a autism specialist. Oga Boniface say in a speech therapist and in a special educator too. Me, I be behavior therapist. The other therapist dey like play therapy, he did there. Cognitive behavior therapy, he did there. So, but for now, I go start with speech therapy because from all of our experience, all of three of us we dey here so. One of the things where they frustrate people with this condition, especially the younger ones, now their inability to communicate. Even that inability to communicate, it increase the behavior problem. So, I no verse so. Will I say the other guests don't come, now then they knock doors so. Okay. Oga Dr. Bako, enter. I don't tell them say me they no verse. Say the fourth person don't come, now he knock door. No problem. So for the therapy now, for the speech, we need speech therapy to support people with this condition. Those will get issues with communication, for instance. So I will let Oga Boniface explain what is speech therapy be and why it's important.
Okay. Thank you very much. I go start by saying speech therapy na a channel. Generally, speech na a channel for us we be human beings to communicate. I like what you talk. Say the main aim na to communicate, ability to to tell you wetin dey their mind.
Yes.
Because if to say they get chance to express that thing, e go reduce their behavioral challenges. So speech na a channel wey be say we dey use dey express wetin dey our mind. Na one of those channels, because we get many other channels wey be say we dey use dey express. For persons wey get problems with hearing, they dey use sign language. For persons wey get visual challenges, they dey use braille and the others. But for us normally, generally, speech na one particular channel wey we dey use dey quickly communicate our ideas. Now, if you see speech generally they develop as the child dey grow. As the child dey grow, e suppose be say as e dey meet with people, dey communicate, dey come in contact with everybody wey dey for society, wey dey for im house. They go dey learn how to imitate wetin they dey hear. Because speech, even language, na learned behavior. Na something wey be say if you no dey for language environment, you no go fit learn am. But e get some peculiar, some unique children wey be say they dey for that kind language environment, they dey grow, but they no sabi learn or pick those particular things wey be say go help them to dey speak, to dey communicate wetin dey their mind, like other children. And some of these children, because maybe the influence of some kind of disability wey be say e don dey already, like wetin you dey talk now, e don dey already. No be say e go na something wey be say we go treat. No, e don dey. So because of that kind of influence, they no fit get those necessary skills wey be say they go use, they pick informations, they pick things, they learn. So speech therapy now na a packaged, arranged management assistant or management technique wey be say professionals don organize a pattern wey be say we go fit help these children wey dey fixated in some parts of their development. We go help them start to dey learn those necessary skills wey they need to get to be able to express wetin dey their mind. Now where speech therapy come in. Speech therapy dey important for children wey get autism. Children, because of course, like Oga Sam talk, children wey get autism get problem with communication. And many of the clients where I don meet, now the first things the parents they meet me, they say, my pikin no dey talk. My pikin no dey talk. Wetin I go do? And I go tell them, say, the problem no be say he no dey hear you. The problem be say he get some skills where he suppose get. Learn language from environment, but he no sabi. So wetin we go do be say we go use techniques, coping skills, teach him how to dey learn these things. Before you know, he go start to dey imitate, dey learn, dey pick am small small. So speech therapy also dey important for other children, apart from children wey get autism. Other children wey get problem with speech, both anatomical and physiological challenges wey they get.
Like stammerers now.
I don't handle a person wey gets cluttering, wey be say if he talk, he dey gather everything, talk and sharp. And this guy, he dey gather everything, talk and he no go even hear one thing. And him be a good entrepreneur. But because unto say he no sabi talk in business, they fail. So speech therapy dey important for various kind of conditions. We be say they affect how to talk within your mind.
Okay, this from what you dey talk to Oga Boniface, you talk something just now. Say speech. Now one channel, not be the only channel.
Yes.
Because why I bring this one up? Be say sometimes I want make you confirm wetin I dey talk so. If it be say at the end of the day, the pikin no fit use that speech, the oral conversation. Na true?
Na true.
So, which means say we go come use other adaptive forms of communication to help the speaking. So just briefly tell us some of these other forms of communication, because I want my parents and listeners understand, say, not be only one path dey for children and persons, people will get this condition. Because if you let your mind stay for only one path, frustration will kill you. And you go cut all other opportunities from this person to learn. Because at the end of the day, if you allow them learn with different paths, it's still possible. Say that side of speech feel wake up. And they go use it.
Well.
But if you go insist, say now only this speech he must use, you not believe or you not agree, make it dey exposed to the other areas, wetin fit be the consequences and why e dey important for us parents in particular to dey open-minded when we dey work with therapists.
Okay. You see, say even for our regular day-to-day life, no be only speech wey parents parents dey use dey communicate with our children.
Yes.
E get one kind eye wey my mama go fit look me. I go understand all the things wey you dey talk.
talk with him out.
E get another eye wey she go look me, I go know say you are free to go.
You are free to go.
You understand? So e get many forms of language, many forms of communication. The aim, wetin go dey your mind be say make my child, make him dey able to share wetin dey in mind. Now wetin be the focus? Because many people go meet me say, I want make the child dey talk, but you see your child get attention problem.
Yes.
Your child get, e no fit even relate, create the bridge between wetin they dey talk with wetin e mean.
Yeah.
And all those things na skills they suppose build. So one other form of communication na picture exchange communication system. The use of pictures, especially for non-verbal children like Oga Sam talk. Children wey be say you go try. Their case or their condition dey severe to moderate in the sense that they still get challenged, they still get, no matter how you try. But you see, when you put that picture exchange and they understand how to use that particular picture exchange communication system, you go find out say they express wetin dey their mind with pictures. And you go understand them clear. And research don show say children wey dey use am most often go start to dey imitate the sound because they dey get modeling as they present the thing. The parents go read am now, they go hear. And as they read am here, they dey learn. Before you know, they go dey imitate wetin they dey hear. Like I talk say, language, you must learn am for a language environment.
Na learned behavior.
It's a learned behavior.
So which means every resources wey we fit use to take help the pikin, now we must use.
Yes, it is very important.
Dr. Bako, welcome, sir. We go back small because you know say because you know say this one a new channel for us.
Yeah.
And
yes,
we get new people wey just dey join us today.
Yes.
Even though we don waka go front small, but
Yeah.
we get new people, so we need to also welcome them into the family.
Exactly.
So we don't. I be say now you go tell us what your autism be, but you not quick come. So, Oga Sam, I first you come today.
Well, this one she don't still answer that. How should I carry first me come when I should be the base?
Oga Sam, first me this year for inside my house.
Yeah. Okay, thank you very much, man.
Oga Sam don't explain to us what autism be. So me, I want you now make you tell us, make you give us some tell us some things about this condition from the aspect of medication. Yeah. So why medication? What will be the benefit and what will be the advice you will give parents?
Oh, thank you very much. Bless, I will start by first introducing myself.
Yes, sir.
Because this one a new channel.
Our people never know you. So you need to
yeah. So my name is Dr. Estefanus Bintum Bako. I'm a neurologist with Jos University Teaching Hospital. And somehow develop very, very good interest when it comes to children where they grow with some abnormality, some kind of developmental problem, especially when it comes to their learning and an ability to at least assimilate things within their environment. So someone, in as much as I mean, develop am tete, but Madam Odupe and Sam, they don't push me, they don't turn me to expert by force. Even because of them, I have to be reading things as regards that, which is a very good thing, which has also helped me at least. It don't make me
so
better.
You go pay. That be for free.
It don't make me really better.
You dey gain.
Seriously. So as a fan, looking at socially when we talk about autism, we know say I believe so maybe somehow we already get insight as regards some of those risk factors. Because really the causes will not really be certain about the causes. But you know say plenty risk factors they related to them. Just the way we'll talk about certain ones where we'll say paternal age, some will say maternal age, some will say age at pregnancy, some will say, especially for our environment, birth defects, birth processes, delayed prolonged labor. Now some of those common things where they affect us, especially for this part of the world. wherever them one picking oxygen, you know, really get time breathe when it's supposed to breathe, oxygen no reach the head, and the labor they too long than when the picking supposed at least come outside, at least breathe well for normal environment. Some of all of those things. Because the deprivation primarily be say when body or brain no get oxygen or glucose as at when it's supposed to get them. Now there are more of those problems they start from. Because somehow immediately you will not affect some certain part of the brain. And somehow some of those children present with all of those behaviors, florid of them, which I believe we already talk about as some of those, their attention span, they very low, hyperactivity, and some of them, and some of those complications. Just like before we talk, say some of them, they follow other medical condition, carry follow come. The seizure disorder, hydration for seizure disorder, and stuff like that. So plenty of them follow come. And some of them, there are medical conditions which fit carry help them, especially for those ones who get some kind, because complications deal with them.
Yes.
So then they prone to depression. So then because of the isolation and how people they see them like they're different. For even their classmates don't even want to relate with them like that.
Classmates far, family.
Family itself. They'll say get one can pick you, get one can score normal like that.
Family.
So they go even isolate the picking for inside the house. They will see the like body.
Yes, nowhere.
Instead of accepting them and see how to at least move on. So some of all of those things will affect the beginning. Some of them they prone to depression and everything. And they can even get suicidal ideation.
Yes.
As in they like that, so even when, because some of them with time, some of them they feel talk small. But you see, then they isolated, depression feels setting. And if you just keep any poisonous thing around them, then feel use them. Just feel say nobody like them for the house. The brothers, when they hate them, the ones with their brain never they develop very well, they'll believe say this one don't draw the attention of the parent. But when we hit them, they will maltreat them, especially in the absence of the parent. That's why I can remember some of the programs where they do say somehow how we'll carry the children, the brothers of the person, carry everybody along for the family, the house, and even somehow the society at large. Some of them will get some hyperactive behaviors. You know, say dopamine they play one major role. We will give some drugs from our own side of medicine where it will make the pikin calm down, and it will help them at least within that short period of time where at least in they calm, will feel assimilate, and it will help with learning. So very many things they will feed do one way or the other depending on the symptoms. But as a fact, we know that medically, maybe like something that fit cure, but something we primarily we manage. Not just the basic thing, but that.
And I believe say, I believe say, as Dr. Bako talks, so only medicine not go fit do this work.
At all. Plenty factor to.
Because just like only therapy sometimes no go fit do the work. Because as we talked before, this autism not be the same for everybody. Now 3 levels, you know, mild, moderate, severe. You get another level, profound. Because what make they always talk these 3, we say these 3 now get the opportunity to improve. When something done profound, you don't be say now patience now you go take until they learn. Exactly. That picking and I go come teach you patience because you go just they do the much where you go fit do. Exactly. But between that mild to severe, you fit still improve them with early intervention. With early intervention and continuous intervention. But either way, medication alone. Because not be disease, not go fix you.
Maybe like malaria, you don't treat it.
So anything we would they do, we must pair them with therapy.
Exactly.
So Oga Boniface don't talk about speech therapy just now because communication play a massive role for how people with autism they feel they engage with themselves and their environment. So the other big one we'll go talk about now, and Oga Sam will help us understand that one. Now, behavior therapy.
Behavior therapy.
So, and behavior therapy, na different one day, but a very old one and sustained one so far. Na ABA.
ABA.
So, wetin be ABA?
Okay. Make us start with to break down the acronym. So ABA na actually acronym for something. The A na for applied, B behavior, A analysis. So applied behavior analysis. This is now one of the leading forms of therapy for children and individuals when you get autism. And why we dey consider them as one of the leading forms of therapy. Now, because say this particular form of therapy, they cover almost all the areas of deficit or all the areas of challenges where they affect people when get autism. And make a break it down. ABA in a scientific approach where they hinged on the theory of behaviorism. I don't they speak English. I dey feel myself small.
Now pidgin English channel. So they hold yourself back small.
Okay, so basically, behavior na anything we they do.
Yeah, you need to do exactly.
So the fact say you dey sit down here and you can't keep your hand like this.
That behavior.
Na behavior.
Because some of our people they feel sit down. Doctors of keep hand.
I talk something way funny now, you laugh. Na behavior.
Na behavior.
But inside this behavior now, you get some behaviors we will consider this one correct behavior,
Yes.
acceptable behavior.
Yes.
We go feel allow this one. We now this kind of behavior one they see for this environment.
Yeah.
So you go see person way maybe get loud mouth or they do anyhow for different space. Maybe when in day in house or place where in day comfortable. If he enter official space, he must go coordinate, he go
Yes.
package. You know, say Kai, I know if they lose guard for here. I go need. I don't enter where.
I need to
rules
behave.
dey. this space big past me, so make her. So, meanwhile, I dey talk about acceptable behavior,
Yes.
socially acceptable.
Acceptable behavior.
Then, if you get some other behaviors, what would they call? Kai, this one na wahala. Challenging behaviors. And when it comes to autism intervention, all these other ones, these problem, challenges, and the rest, we go call them challenging behavior.
Yes.
For
You know they
AB
call them bad behavior.
because every
No behavior
behavior,
bad for them.
thank you.
Because all their behavior are means of communication.
e get function, you get wetin they
function.
try achieve with that
Yes.
behavior. So now when you fit don identify wetin they try achieve with that behavior, now you fit label am properly.
Exactly.
So this ABA now as a strategy, they help increase and improve behaviors wey we consider proper behavior.
Yes.
So something wey you for like make pikin dey do, okay, if we call you, you suppose answer.
Yes.
If I come meet you now and say, bros, how far now? Wetin be your name? You tell you tell me your name. Correct.
Yeah.
But if I come now, tell you, bros, how far now? You don't even they look my side. You go talk, look this other side. I tell you, okay, my name na Ini. They call me Oga Sam. Wetin be your name? You don't even send me. You don't behave like say I even did there. Me say I go the reason wetin do me. I say wetin I do this guy. You never know me before.
Yes.
So in that case, we go know say Kai. That guy when they answer person greeting.
Yes.
If
But let me
you-
say no answer.
So ABA now go help increase behavior like say I hail you, you hail me back.
Back.
I tell you how far now, give me a high five, you give me a high five.
Back.
You don't they respond appropriately.
Yes.
Then behaviors where we consider challenging. Say if I tell you, I bet help me close that door, you begin to shout.
Yes.
Because say you no wan close the
Because
door,
you
you
wan
begin
close.
scatter things, you begin scatter everywhere, they vex anyhow. For only door where I tell you make you close.
Close.
That challenging behavior now, with the use of behavioral principles and that ABA,
Go bring
it
them
go
down.
help teach the individual how to reduce that behavior we will consider socially inappropriate.
Yes.
So that in a nutshell, ABA go help improve behavior where we like,
And it go help
reduce behavior where we
we
no like. In addition to this, ABA and another strategy where they use take these skills.
Teach skills.
You know, say you get some things where if pikin born, just for the fact say he dey within the environment, he dey play with other children, he go dey learn something. They no go keep and teach am.
Yes, you go learn about
Just making they observe as others they move,
Himself go
they
dey
do
do am.
things. He himself go they pick
Go
up.
dey pick one or two.
Now wetin they call incidental learning.
learning.
Children and people when get autism, then they struggle with some of these incidental learning. So most skills you go need sit them down, teach them.
Yes.
Make them feel they grow, reach place where they go, they independent.
Independent.
Exactly. So ABA they teach skill, they increase proper behavior, they reduce challenging behavior. And one strategy inside these behaviors, inside this behavior therapy, ABA specifically, we say he get one scientist back then where they call Ivan Pavlov. We run one experiment one time with dog. he condition.
Conditioning.
So usually, if he carry food one given dog, you go see say the dog go begin salivate. Just like make you see better chow. You ma, even if not be your own, you go dey feel one kind say kai. Oh no worry, I go save for this one. So immediately he go bring the food.
Yes.
The dog go begin salivate. He go bring the food. The dog go salivate. Then he go chop the food. Then he come reason and say kai. Okay, make him try out something. He go first ring bell. Then bring food. That period when he begin they ring the bell, the dog no go salivate, but he go bring the food. The dog go salivate, chop the food. Over time, as he continue to dey ring the bell before he give the dog the food, the dog come begin salivate immediately. He hear the bell. So at that point, the dog don't pair
understand
those he don't connect those two things. Say, Kai, once I hear bell, food go follow.
Food go follow.
So I don't even need wait to make the food come. Once I hear bell, I go salivate. Eventually, the man cuckoo commot the food. He go just ring bell. The dog go begin salivate. Learned behavior. At that point. So it can't show say human being, anybody, you feel actually condition them to learn particular ways of doing things. And now from there they come bring up the principles of reinforcement and punishment. If okay, like Mr. Boniface there, he talks something, we agree with him. All of us hail and say, "Kai, better talk, better talk." He feel good about himself. If we do this podcast, if we call and say 12 a.m. today, we go do another one.
I got it.
He go come because the guy, him man a boss for this place. You understand? But meanwhile, if him been talk something, then we no agree. Call this a guy. Yeah, talk. No.
I'm not gonna call him again.
If not the way we take respond to him when he talk. Next time, even when we call, ensure if you see your call, if you behave like say you not see the thing.
Because we don't appreciate your efforts.
Or immediately the call enter, you go put in phone for airplane mode. When the call don't go like that. So, if you provide reinforcement, the likelihood of that, say that person go do that behavior again,
It's
go increase
high.
because
Yes.
he go give me biscuits,
Go give
he
me
go give me
biscuit,
sweets, he go give me high five, and I like all those things. So I go do them again.
Yes.
I sure see when I don't notice, even your children or
Yeah.
the teacher for class. If you they help Pekin, maybe he write one line, you hail him. Next time if he write, he go call you, say, come see, I don't. So that behavior now, so you go to increase.
That's going to increase.
But punishment, on the other hand, Pekin do something, like waiting Mr. Boniface talk, you give him one kind eye like this, or you warn her steadily, or you tell her, oh yeah, go face wall there. Punishment.
Yeah.
Next time, at least, children go test boundaries more. Next time, you go still try them to see what you go do. Whether you go still tell them, hey, stop that. You tell them again next time. Maybe you go try and say, when I see Male or I see this man, I no go do that thing. But when I see who no know our deal, I go try him. But maybe in try and the other person still follow. Hey, stop that. Next time, now so that behavior go dey reduce. So in a nutshell, now waiting ABA there about with that, following systematic approaches to take shape behavior, teach new skills, teach appropriate ways of behaving.
Okay, we don't go school, come back. Okay, Sam, you do well. So my people, I hope so that I don't understand because ABA now one particular word way common. And within autism environment and behavior management environment, you must hear ABA. So now ABA is not strange to us again. We know say ABA na principle where we involve say you go manage behavior because behavior na wetin we dey do period. And our children, the biggest challenge wey dem dey get na behavior. Because everything and many things now they cause behavior issues. They won't do something. They not fit tell you say they won't do one. They present that frustration somehow, but that somehow to that behavior, and that behavior they comfortable both for them and for us where they are around them. So the question wey me I get for myself, I tell you just now, say I go answer question. I go ask myself question and I go answer. So the question when I go ask myself now, I be say, wetin be this behavior in within, I mean, as it relates to how to help manage behavior. We must understand behavior before we start with the manager. So behavior, as we talked just now, for ABA principles, and even if we look at for everyday principle, now wetin we dey do? Because everything we dey do, they affect us one way or the other, whether give us happiness or not give us happiness. But the thing be say, for us to understand this behavior, we must understand wetin dey cause that behavior. So this acronym dey, I don't speak English. We go dey try. So it get wetin they call ABC of behavior. That A, na big name o, they call am antecedent. But wetin that one mean be say, anything will happen before challenging behavior starts. Right now, because we dey talk about children wey get autism, the focus now na challenging behavior. Good behavior, all of us happy for am. But how to manage behavior, now we dey talk now. So everything will happen before that challenging behavior starts, now be antecedent. Then the behavior na the action now, wey that person come dey show after that thing don happen. Then the consequence now be say, wetin be the result of that action wey that person dey show. Which means say, at the end of the day, if we wan help person wey dey get behavior problem, we must dey very observant. This one now, I dey talk in particular to papa and mama, because therapists go do their own, school go do their own, they go come back come meet us for house. And as parents, now we near them pass. So if we get pikin wey dey on the spectrum, or we will not understand how they behave, make we focus for that pikin. Make we know wetin dey happen before that behavior starts. Then after that behavior starts, wetin follow am? Because if it be say the pikin dey hungry, now you start that behavior. Or you say, which means he needs something. Or you say, make the pikin close door, as Oga Sam talk just now. He no wan close door, which means say he no wan walk be that. Na another strategy you go take manage that kind of behavior. Or if it be say get wetin the pikin dey fear, then that behavior start. So you need to remove that fear element, come out for that environment. Or the pikin, you don't sit down, you don't even look am. Okay? Make I shout. If I shout, you go see me. Behavior, it don't start in drama. Maybe you go look am. You look am now, you don't achieve attention. So all of this behavior, so behavior now, if it be for attention, if it be for what they want, if it be for say, I don't want to do what you they tell me, make I do. Or if it be say, they enjoy am. Pikin go just carry lights, switch lights, you go they switch them on, off, on, off, on, off. You na morning, you na night, so on, off. Try understand. You say, speaking, they enjoy this thing. No? Now that one, now be sensory behavior. That one not because they hungry, but in just they enjoy it. So, papa and mama, even teachers, wanna pay attention to these reasons why pikin they behave the way they behave, so that way una go fit dey comot the one wey not join, can't help know wetin be the pikin problem. But at the end of the day, teacher no dey diagnose o, papa and mama no dey diagnose. Una go still go hospital, compulsory. But when una reach, the doctor go ask una question. So it good make una dey observe. When una observe, una go tell doctor wetin una see. The doctor will come join his own knowledge, plus wetin, because now una dey with the pikin, plus wetin una brain come take give una diagnosis, so that una go from there know wetin the pikin need, how to dey follow am. They say our time don dey go. We talk the time wey our time dey finish. 10 minutes, abi? No, we finish for 10 minutes. Abi more add more time. Okay, so any questions there? we not tell our audience so say make dem set questions so opportunity there for them to ask questions if dem get any question. No question, huh? Okay. So as I talk just now, abeg make una pay at ten tion to the reason wey the behaviour take, the reason wey e dey happen and why at the end of the day, at the end of the behaviour, wetin come out for inside. That way una go fit know wetin una go dey adjust. But the first number one thing wey we must do as parents, if we see anything wey different from our pikin from the age of 2, you know, dey play with the friends, you know, dey, as oga Sam talk before, you know, dey talk well, you know, dey follow, you know, dey do it, all the milestones wey you suppose follow, you know, follow am well. When I not talk say for our family they dey delay, that one na big family, this one na one person. Family different. This una follow na pikin according to na pikin, no be according to wetin dey happen for inside family. Carry this pikin go meet neurologist, go meet pediatrician. Then with all your observation, e no quick waka, e no quick crawl, e dey take belle dey move when e no suppose take belle move, you know, e just sit down. Which one dey come before you sit down? No be crawl.
No, you go lie down first.
Then you go turn.
Just
after you sit down, you come crawl.
He miss the milestones. He miss the things you suppose do. Not talk to my pikin you're fast. No.
And just to add on wetin you don
Yes.
wetin you been talk before
Yes.
concerning the excuse wey many parents dey give.
Yes.
Say for our family,
Exactly.
we know the quick talk. Even
No.
my husband, mama talk say he talk late and things like that. I say okay, even though that is a possibility.
Yes.
To be on a safer side, you no mean say make you just keep the child, because early intervention, like what you
That
talk,
be the
is
key.
very, very important.
Very
so
important.
for you to be on a safer side, carry the child first, go see neurology. Make una
Yes.
make sure say this thing no be another wahala.
Yes.
We want make it be say na delay something wey
Yes.
he go catch up.
E go
Na
catch
wetin
up.
we like.
Yes.
But if na wahala wey dey there, you suppose dictate am early enough and handle the problem. So make we no just accept some kind of notions wey we say we go carry to our heart, say oh our family like this. No, carry the child first, go address the matter, check first. They go tell you say okay, start with this, start with that, do this, do that. You go know wetin you dey handle.
Okay, my people, they don't they tell me for here. Say time don't they go. Una do well, oh, so una join us today. Oh. We hope so una go dey join us every Saturday. Make una share this our video so for our for Facebook. Anyone wanna take join Facebook, Instagram, or YouTube. If una still get any question after this one, una leave am for comment section. We go respond to una. Oga Bako, your final talk.
Thank you very much, my people. You know, the people like us today now, introduction primarily. Will come there. Today, now Simon Boniface, I'm then they in charge today. So, my people, now well done. Thank you very much for listening to us. More of this will always be coming every week. And if I get any question, and if you just put them for the page,
Yes.
guarantee say most of my questions will be one of the first things we will start
Yes.
talk about before we enter the next episode. Thank you
Yes.
very much, and Mona get a very good day.
Oga Boniface.
Okay. So like I say, if you don't dey follow us from the beginning, you go know say this program dey loaded. It dey loaded indeed, and I sure say na no dey disappointed as we talk of beginning. So thank you very much for joining us. We go like make you dey join us, make you dey invite people as well. May they also join us. They know, because if one can teach one, one will help one, and what a wonderful world it will become. So that's what we really need.
Yes, that's what we need.
This Oga Boniface just dey finish work.
That dey finish work.
It be like
I go dey find una for English now. This na pidgin English. If una know say na when I start this program, now I start to dey speak pidgin. My man don't let me speak pidgin when I dey grow. So nobody go speak English for here. This na my pidgin English time now.
My people, I want thank una, especially so na still get mind join us again today, and I beg one encourage una, just like wetin Oga Boniface talk. Tell person, make it tell another person. And the more people will figure on this program, we go fit they understand wetin dey go on with some of these children when we dey see.
Yes.
The more acceptance we will get for society,
Yes.
and the more support even.
Yes.
special education, becoming a therapist, you know, go be something where be say they reject you for medicine where you won't go study. Then you can't go to once you understand what they go in for, you go get purpose. You go get purpose. So
You go get purpose.
so I beg more than join us next Saturday again. Thank you.
Okay now, I bet shall not see now. All of us now go benefit one way or the other. If all of us understand what these conditions be, and we know how to support our children, fellow human beings for this our society, our government too go also participate more. Because the thing be say all of us now be government. If we will be family, we not get value for our family members. We not see any reason why their matter be our matter. Then nobody go know. Because it not bother us. But if it bother us, people, now we go use that one as power. Anybody will come ask us, say, come, oh, I won't go here, oh, support me. Say, fine, I go support you. Oh. But this thing when I want, I don't join the work where you go do when you reach there. Now so the change go they come small. But if we not get interest for them, we no one know. We no know. Everybody go to suffer. Whether you get money, whether you not get money, everybody go suffer because these conditions they're not easy. And these children they go grow. Whether you help them, you not help them, they go grow and they go stay our society. There will be problem for all of us. So make all of us join this program. They know what these conditions be so that we will fit support each other and we will fit grow a better, more inclusive society. Now let me fit speak English for here. So now do well, my people. God bless you.